Hello and welcome to Human Potential Healthcare's COVID-19 Emergency Temporary Standard Plan training for all employees. Our goal is to prevent the transmission of COVID-19 in the workplaces. Managers, as well as non-managerial employees and their representatives, are all responsible for supporting, complying with, and providing recommendations to further improve this COVID-19 plan. We are committed to providing a safe and healthy workplace for all of our employees. Therefore, we've developed this COVID-19 plan, which includes policies and procedures to minimize the risk of transmission of COVID-19 in accordance with OSHA's COVID-19 Emergency Temporary Standard. Due to our staff working in multiple host facilities that are substantially similar, we've developed a single COVID-19 plan for the similar workplaces with site-specific considerations included in the table on the following slides or outlined in your written plan. Please be sure to see the additional exhibits for the specific locations you are assigned. Our standards are the minimum standards. Please note that host facilities may require additional measures above and beyond those of ours, especially in times of higher cases. This includes, but is not limited to, limiting points of entry, screening all entrants, and implementing distancing and barriers. For our hospitals and ambulatory care facilities, most are requiring minimally to wear 1 or 2 layers of non-respirator facial coverings, gloves, and disposable stethoscopes and other tools. When there are COVID-19 positive patients on the unit you are working on, the facility may require use of an N95 respirator, full medical isolation gowns that are disposable, protective shoe covers, also known as booties, gloves, and safety eye protection. They could also require a face shield to be worn, giving you at least 2 layers or more, and ensuring that they're worn over your nose and mouth. In general, all N95 respirators will be required to be donned prior to entering and doffed immediately after services are performed. Please also note that in some locations that are seeing extremely high case numbers, they may require all workers to get vaccinated. If you are unable to get vaccinated, please let us know at that time so that we may find an alternative location. Also note that Human Potential Healthcare's employees do not perform aerosol generating procedures, or AGPs, on a person with suspected or confirmed COVID-19. We also work in behavioral health facilities with non-ambulatory care, assisted living facilities with non-ambulatory care, and correctional facilities with non-ambulatory care. Included in that also would be covering skilled nursing facilities, hospice, and doctor's offices. Since the ETS is not applicable under the section 1910.502A23, non-hospital ambulatory care only, all non-employees are screened prior to entry, and people with suspected or confirmed COVID-19 are not permitted to enter. The ETS is not applicable to buildings where only support services are performed. However, please note for safety, some facilities may opt to follow protocols established for hospitals and ambulatory care facilities. So you may be asked to don the proper personal protective equipment. All right, so what is considered ambulatory care? According to the Agency for Healthcare Research and Quality and the Institute for Patient and Family-Centered Care, ambulatory care refers to medical services performed on an outpatient basis without admission to a hospital or another facility. This is going to include diagnosing, observation, consultation, treatment, intervention, and rehabilitation services. Ambulatory care is provided by healthcare professionals in an outpatient setting. Safe and highly qualified ambulatory care requires complex information management and care coordination across multiple settings, especially for patients with chronic illnesses. What's the difference between outpatient and ambulatory? The word ambulatory is an adjective that means related to walking or ambulation. It is used in several different ways in in medical situations, and can refer to a type of patient and care setting, what a patient is able to do, namely walking, or for equipment and procedures that can be used while walking or by outpatients. Ambulatory care sites allow providers like hospitals, health systems, and physicians to more proactively manage chronic conditions, prevent serious illnesses, and improve overall population. This means that the service would be provided same day instead of staying overnight like in a hospital. All right, so let's talk about infection prevention. What is infection prevention and control? It's a practical, evidence-based approach which prevents patient and healthcare workers from being harmed by avoidable infection and as a result of antimicrobial resistance. Who is responsible for this spread? Effective practices that prevent and control healthcare-associated infections, such as hand hygiene, surveillance, antibiotic prescribing, and the provisions of a clean and safe environment are fundamental building blocks for safe, effective health and social care. The chain of infection has 6 elements, as you can see on your screen. We need an infectious pathogen, a place to stay, a way to get out, a way to travel, a way to get in, and a new victim. So this is why we're taking steps to prevent the spread of an pathogen or other item to limit anyone else getting an infection. Some of our locations are going to have situations where they're limiting and monitoring points of entry to the setting. They may screen and triage all clients, patients, residents, delivery people, visitors, and other non-employees entering the setting for symptoms of COVID-19. They're probably going to implement other applicable patient management strategies in accordance with CDC's COVID-19 infection prevention and control recommendations. They're also going to encourage the use of telehealth services where available and appropriate to limit the number of people entering the workplace. With capacity limits, waiting areas may be modified to ensure people from different households do not sit within 6 feet of each other. When possible, patients and their escorts are asked to remain in their vehicle until they're called to enter for their appointment. So now we're going to talk about standard and transmission-based precautions. We've developed and implemented policies and procedures as part of our plan. This is going to be in alignment with CDC's guidelines. Our host facilities are also doing the same. We have reached out to them to get a copy of their plan, and that is how we are implementing it into our plan. We're also going to make sure that we're following OSHA's COVID-19 healthcare worksite checklist and employee job hazard analysis. We have already done this prior to the beginning of our training. However, we are going to continuously do this, so you may be asked to provide feedback as well that we might not have firsthand knowledge of, or as things change when rates go higher. With the prevention bundle, we're going to make sure we're following standard precautions. We're going to take transmission-based precautions when we have people that have COVID-19 or presumed to have it. We're going to make sure that we're doing environmental cleaning and disinfectant frequently, and that we're using EPA, Environmental Protection Agency's listed approved disinfection products. We're going to minimize use of devices and sharing of devices. And then we're going to also have an antimicrobial stewardship. So we're going to make sure we're utilizing products and disposable items as much as possible that would prevent transmission. So when we talk about standard precautions, we want to do that for all patients and residents, regardless of their diagnosis or presumed infection status. This is going to include blood and bodily fluid secretions, except for sweat, regardless of whether or not blood is visible, any non-intact skin, and mucous membranes. Three main components are going to be hand hygiene, personal protective equipment, also known as PPE, and then respiratory hygiene and cough etiquette. Other components can be injection safety, medication storage and handling, and cleaning and disinfection of devices and environmental surfaces. All right, let's talk about hand hygiene. Soap and water, definitely whenever you have visibly soiled hands, if you've had potential contact with bodily fluids, potential contact with spore-forming bacteria, and then potential contact with infectious diarrhea during a norovirus outbreak. And then, of course, COVID-19. We want to make sure that we're not wearing artificial nails or extenders when having direct contact with patients and residents. Keep our natural nails short, less than 1/4 inch. And then we're following proper drying of our hands with paper towels or other objects that we are provided, because this is an integral part of the routine of hand washing, making sure our hands are dry after we've washed them. When it comes to alcohol-based hand rubs, our host facilities will provide alcohol-based hand rub that is at least 60% alcohol. You'll use this before and after direct patient or resident contact, before handling any medication, before donning your sterile gloves to insert an invasive device, and then before and after handling respiratory devices, catheters, and other items. The next few slides will discuss personal protective equipment, as known as PPE, and proper use. Some of the common recommended personal protective equipment for staff is going to be an N95 equivalent or higher level respirator, or a mask if respirators are not available. Gloves, gowns, eye protection, could be goggles or disposable face shields that cover the front and sides of your face, and physical barriers, for example, plexiglass. Please note that there are PPE storage requirements as well. While PPE needs to be stored in a specific drawer or cabinet, it must also be easily accessible in case of emergencies. Facilities should consider having extra PPE on hand, and in the case of lost, damaged, or compromised equipment, injuries can be avoided by having extra equipment stored on site and within reach. When it comes to gloves, we want to make sure that we are covering our entire hand and coming up our wrists. We want to also make sure we are checking our gloves for any tears, holes, etc. Because if we don't check and we have a situation of a tear, this would allow foreign body into our gloves, and therefore they're no longer protecting us. It's important that you change your gloves between tasks and procedures on the same patient that may result in contact with potentially infectious material. You want to change your gloves between care for patients, and do not wash gloves for reuse. Make sure you have the proper size. Typically, they're going to come in small, medium, large, one size fits all, and extra large. They do have 2X size gloves as well. Goggles, gowns, and face shields are next. We want to make sure for minimum PPEs for general triage. We're wearing a face shield and potentially eye protection as well. We want to have either a surgical mask on or, if needed, an N95 respirator, a basic level isolation gown, and disposable gloves as indicated. For example, when presence of a skin lesion or contact with blood or bodily fluids. If there is a suspected or confirmed coronavirus case, you want to make sure that you're wearing a face shield and goggles and potentially even a cap, your N95 respirator, a higher level isolation gown, and of course, disposable gloves. Pictured on the right in your screen, you'll see that there are eye protective in the mask situation, and then there's also an example of a face shield over top of a mask providing additional protection. So we wanted to show you some examples. Now, when it comes to masks, face masks are going to be provided by the host facilities. They will be FDA cleared and authorized by an FDA emergency use authorization or otherwise offered or distributed as described in an FDA enforcement policy. Host facilities will provide all human potential healthcare employees with a significant number of face masks, which must be changed at least once a day, whenever they are soiled or damaged, and more frequently as necessary for patient care reasons. Host facilities may also provide a respirator to employees when only a face mask is required. When a respirator is not otherwise required by OSHA's COVID-19 ETS plan, and when doing so, will comply with OSHA's COVID-19 ETS mini respiratory protection program. Human potential healthcare and host facilities will also permit employees to wear their own respirator instead of a face mask, and in such cases will comply with OSHA's COVID-19 ETS mini respiratory protection program. Additional information about when respirator use is required can be found in the written plan. Additionally, if you are going to wear a respirator when it is not required, we will cover with you in person the specific OSHA requirement plan for those situations, because we have to make sure that you are safe at all times.
Respirators and surgical masks are two types of personal protective equipment, or PPE, that are used to protect workers in healthcare settings. A surgical mask is not a respirator, and that's an important distinction for you and your employer to understand. So let's review the significant differences between a respirator and a surgical mask. What is a respirator? A respirator is a type of personal protective equipment designed to reduce your exposure to airborne contaminants. Respirators are available in different types and sizes, and the respirator you use must be individually selected to fit your face and to provide a tight seal. A proper seal between your face and the respirator forces inhaled air to be pulled through the respirator's filter material and not through gaps between your face and the respirator. If your supervisor requires you to use a respirator, it must be NIOSH certified and must be used in the context of a comprehensive respiratory protection program according to OSHA's Respiratory Protection Standard 29 CFR 1910.134, which includes but is not limited to medical evaluation, fit testing, and training elements. Respirators are used routinely to protect healthcare workers against airborne infectious diseases, such as tuberculosis, anthrax, SARS, and hantavirus, because they protect against both large and small particles. What is a face mask? A face mask is a loose-fitting, disposable mask that covers your nose and mouth. Surgical masks, dental masks, medical procedure masks, Isolation masks and laser masks are all types of face masks. Face masks help stop large droplets from being spread by the person wearing them, whether that person is a patient or a healthcare worker. Face masks also keep splashes or sprays from reaching the mouth and nose of the person wearing them. However, face masks are not designed or certified to seal tightly against your face or to prevent the inhalation of small airborne contaminants. During inhalation, small airborne contaminants pass through gaps between the face and the face mask and the material of the mask. Remember, face masks are not considered respirators and they do not provide respiratory protection. Only face masks that are cleared by the U.S. Food and Drug Administration, the FDA for short, may be legally marketed in the United States. The FDA approval signifies that they have been tested for their ability to resist splashes of blood and other body fluids. To offer protection, both face masks and respirators need to be worn correctly and consistently throughout the time they are being used. When used properly, face masks and respirators both play an important role in preventing exposures to different types of hazards. If you need the protection of both a face mask and a respirator, you can use a surgical N95 respirator. Surgical N95 respirators offer protection from both airborne and body fluid contaminants and are approved by both NIOSH and the FDA. During an infectious disease outbreak, such as SARS or pandemic flu, face masks and respirators should be used in conjunction with other controls and interventions that are known to prevent the spread of infection. These include engineering and administrative controls, such as installing sneeze guards and permitting teleworking, and work practices such as cough etiquette, hand hygiene, and avoiding large gatherings. For additional information on respiratory protection in the workplace, consult this website. Mention or visual display of the name of any company or product in this video does not constitute endorsement by the Occupational Safety and Health Administration. This video provides a brief overview and general information regarding respirator use in your workplace. It does not cover all of the requirements specified by OSHA's Respiratory Protection Standard at 29 CFR 1910.134 and is not to be used for compliance purposes. Consult the Respiratory Protection Standard for comprehensive information about respirator use in your workplace.
When it comes to putting on your PPE, also known as donning your PPE, there is a certain sequence for putting it on to make sure that we are not contaminating our items. So first we want to put our gown on, then our mask or respirator, followed by goggles or your face shield, and then last we're going to do our gloves. Use of safe work practices to protect yourself and limiting the spread of contamination is the important part here. The CDC wants you to keep your hands away from your face, limit the surfaces touched, change gloves when they're torn or heavily contaminated, and always perform hand hygiene. Just as we have specific procedures for putting on our PPEs, we're now going to talk about taking off our PPEs, and it is not in the same order. First, we want to take off our gloves and our gown, then goggles or face shield, followed by our mask or respirator. And then we're going to wash our hands or use an alcohol-based hand sanitizer immediately after removing all of our PPEs. It's important that we go in this order so that we prevent anything splashing up to our face or us inhaling any items. All right, so now we have some additional exceptions to our requirements for face masks. If you're alone in a room, if you're eating and drinking at the workplace, and you have other people at least 6 feet away from you, or you're separated from other people by a physical barrier, when you're wearing respirators, when it's important to see a person's mouth for communication who maybe is deaf or hard of hearing, and the conditions do not permit a face mask that is constructed of clear plastic or having a clear plastic window, when in this case, the host facility will ensure that each employee wears an alternative, such as a face shield, if the conditions permit. You'll be given a face mask or a respirator upon entering a host facility. We will also provide face masks, respirators, and face shields to employees if needed. If a face shield is required to comply with OSHA's COVID-19 ETS or our plan or the host facility's plan, we will ensure that either the host facility or ourselves, as appropriate, that they're being cleaned at least daily and that they're not damaged. That way we can ensure proper protection. So continuing on, when we may have exceptions to the requirement of face masks. When an employee cannot wear a face mask due to a medical necessity or a condition or a disability, when working outdoors for patients and visitors not being within 6 feet, when the use of a face mask presents a hazard to an employee of serious injury or death, and then when outdoors performing personal activities such as eating and exercising, commuting, or smoking, even if other people are present. We will not prevent any employee from voluntarily wearing their own face mask or face shield in situations when they are not required, unless doing so would create a hazard of serious injury or death, such as interfering with the safe operation of equipment.
This is a video about the different types of respirators that workers might use in their workplace. If your employer requires you to wear a respirator on the job, the Federal Occupational Safety and Health Administration, also called OSHA, and state OSHA agencies require that your employer select an appropriate respirator for you. A brief overview and general information about various types of respirators and some of your employer's responsibilities under OSHA's Respiratory Protection Standard will be discussed in this video. This video can be part of the OSHA-required respiratory protection training, which includes many topics, like how to put on and take off a respirator, and how to use, clean, and maintain your respirator. Your employer must also provide you with worksite-specific training. There are two main types of respirators: air purifying respirators, which use filters, cartridges, or canisters to remove contaminants from the air you breathe, and atmosphere supplying respirators, which provide you with clean air from an uncontaminated source. Respirators can also be classified as tight-fitting or loose-fitting. Tight-fitting respirators need a tight seal between the respirator and the face and/or neck of the respirator user in order to work properly. If the respirator's seal leaks, contaminated air will be pulled into the facepiece and can be breathed in. Therefore, anything that interferes with the respirator seal is not permitted when using this type of respirator. This could include facial hair, earrings, headscarves, wigs, and facial piercings. If you are required to use a tight-fitting respirator at work, you must be fit tested with the respirator selected for your use. Fit testing is done to be sure that the respirator's facepiece fits your face. You must be fit tested before you use your respirator for the first time. You must also be retested at least every 12 months to be sure that your respirator continues to fit your face. A fit test should not be confused with a user seal check. A user seal check is a quick check performed by the wearer each time the respirator is put on. It determines if the respirator is properly seated to the face or needs to be readjusted. Loose-fitting respirators do not depend on a tight seal with the face to provide protection. Therefore, they do not need to be fit tested. Your employer is responsible for selecting appropriate respirators to protect you from airborne hazards. To ensure that the correct respirator is selected, your employer must consider a number of factors. First, your employer must identify and evaluate the hazard. Your respirator will need different types of filters, cartridges, or canisters depending on the type and amount of airborne contaminant in your workplace. It is your employer's responsibility to determine which filter, cartridge, or canister is necessary and how often it needs to be changed. For example, respirators that have particulate filters will not protect you against gases, vapors, and the non-particulate components of fumes, mists, fogs, smoke, and sprays. Your employer must also determine if the work atmosphere lacks sufficient oxygen, that is, if it is oxygen deficient or is contaminated to the point of being immediately dangerous to life or health. This is also referred to as IDLH. Only atmosphere-supplying respirators, such as an airline respirator or a self-contained breathing apparatus, also known as an SCBA, can be used in IDLH atmospheres. Once your employer has identified the type and amount of airborne contaminant present in your workplace, your employer will use this information to see how much protection you need the respirator to provide to you. Different types of respirators offer different levels of protection. The measure of a respirator's protection capability is called the Assigned Protection Factor, or APF. This is a number that OSHA has assigned to each class of respirators. It represents the level of protection from airborne exposure each class of respirators is expected to provide. The larger the number, the greater the level of protection. For example, when used properly, a respirator with an APF of 10 will reduce your exposure to 1/10 the concentration of the contaminant in the air. Similarly, a respirator with an APF of 50 will reduce your exposure to 1/50th the concentration of the contaminant in the air. OSHA's APFs can be found in Table 1 of its Respiratory Protection Standard. When selecting an appropriate respirator, your employer must also consider whether the hazard has any additional characteristics that may affect the type of respirator selected. For example, does the hazard irritate the eyes? Do you need splash and spray protection as well as eye protection? If so, you will need a full face piece respirator or some type of eye protection. Let's take a closer look at the different types of respirators that are available to protect you. There are advantages and disadvantages to each type of respirator, so it's important that your employer select the type that's best suited for your work setting and the hazards you face. These are filtering facepiece half-mask respirators, sometimes referred to as N95s. A filtering facepiece respirator covers the nose and mouth and is a tight-fitting air purifying respirator in which the whole facepiece functions as the filter. Filtering facepieces may or may not have an exhalation valve to help exhaled breath exit the facepiece. They need to be fit tested unless you are wearing them under voluntary use conditions. Filtering facepiece respirators filter out particles and do not protect against non-particulate hazards such as gases or vapors. This is a half-facepiece elastomeric respirator. It is a tight-fitting air purifying respirator with replaceable filters for particulates or cartridges or canisters for gases and vapors. In either case, these are attached to a rubber or silicone facepiece that covers the nose and mouth. This type of respirator needs to be fit tested and can be used instead of a filtering facepiece respirator. An elastomeric half-facepiece respirator can be cleaned, decontaminated, and reused. This is not the case for a filtering facepiece respirator, which is normally discarded after use. Like filtering facepieces, half-face piece elastomeric respirators can be used for particulates, but they can also be used for many gases and vapors if equipped with the proper cartridges. This is a full face piece elastomeric respirator. This type of respirator provides a higher level of protection than a half face piece respirator because it has better sealing characteristics. Since it covers the user's eyes and face, it can also be used to protect against liquid splashes and irritating vapors. Like the half-mask elastomeric respirator, this respirator is a tight-fitting air-purifying respirator with replaceable filters or cartridges attached to a rubber or silicone facepiece. It needs to be fit-tested. This is a loose-fitting facepiece powered air-purifying respirator, or PAPR. A PAPR has a blower that pulls air through attached filters. The blower then pushes the filtered air into the facepiece, which covers all of the user's face. Since it is loose-fitting, it does not need to be fit-tested and can be used by workers with facial hair. Another type of PAPR is the tight-fitting full facepiece PAPR. This PAPR has an elastomeric facepiece made of rubber or silicone. It has filters and a blower that operate as they do on a loose-fitting facepiece PAPR. Because this PAPR has a tight-fitting facepiece, it must be fit-tested. There are also half-mask PAPRs, as well as PAPRs that have a helmet or hood. This is an airline respirator. It supplies clean breathing air to either a hood or a facepiece through a long hose from a source of clean air, such as a cylinder or compressor. If the facepiece is tight-fitting, it must be fit-tested. This is a self-contained breathing apparatus, or SCBA. It is a type of atmosphere-supplying respirator. SCBAs have a tight-fitting elastomeric facepiece that covers the user's face. The air is supplied from a cylinder of compressed breathing air that is designed to be carried by the respirator user. The facepiece is tight-fitting and must be fit-tested. As its name implies, this respirator is truly self-contained. These respirators provide the highest level of respiratory protection. You may hear someone refer to a respirator as an N95 or a P100. While most people use the term N95 to refer to filtering facepiece respirators, N95 actually describes the type of filter material and its protective properties. The filter material can be used in either a filtering facepiece respirator or in a filter cartridge that's attached to an elastomeric respirator. The first part of the filter's classification uses the letters N, R, or P to indicate the filter's ability to function when exposed to oils. N means not resistant to oil. R means somewhat resistant to oil. And P means strongly resistant to oil or oil-proof. This rating is only important in work settings where oils may be present, because some oils can reduce the effectiveness of the filter. The second part of the classification, the number, refers to the filter's ability to remove the most penetrating particle size during worst-case testing. Filters that remove at least 95% of these particles are given a 95 rating. Those that filter out at least 99% receive a 99 rating. And those that filter out at least 99.97%, essentially 100%, receive a 100 rating. Using this classification method, an N95 filter is not resistant to oil and removes at least 95% of the most penetrating particles. If you use a PAPR, the high-efficiency particulate air filter, or HEPA filter, that is attached to your unit, is similar to a P100 filter. The National Institute for Occupational Safety and Health, or NIOSH, tests different respirator models in its laboratory to make sure they meet certain minimum performance standards. To become NIOSH certified, respirators must pass the performance tests listed in NIOSH's regulations. For example, NIOSH tests the filter efficiency of the filter materials used in a respirator. When respiratory protection is required, employers must provide NIOSH-certified respirators to their workers. To see if your respirator is NIOSH certified, look for the NIOSH logo, as well as the Test and Certification Approval Number, or TC number. The logo and TC number can be found on the respirator's package or the user instruction insert, and sometimes they appear directly on respirator components, such as the respirator filter or cartridge. If your respirator is not NIOSH certified, do not use it in a hazardous area. You must never alter your respirator. Doing so can reduce its protective quality and expose you to the airborne hazard. Never glue or staple things to your respirator. Do not write on your respirator's filter material, and never put holes in your respirator. However, it is okay to write your name on your respirator's straps. You must never use unapproved parts on your respirator. This video has provided you with a brief overview of the types of respirators available and how they are selected to protect you against airborne workplace hazards. There are many other things that you must know and do before you can safely use a respirator in a hazardous work environment. While this video may be part of your respiratory protection training, your employer must also provide you with additional training on respirators, including worksite-specific training. Remember, if you don't know if a respirator is needed for the task you will be doing, or if you are unsure about how to properly use a respirator or which filter or cartridge to use, talk to your supervisor before entering the hazardous area. For more information about respirator use in your workplace, refer to these OSHA and NIOSH websites. You will find OSHA's Respiratory Protection Standard, additional respirator training videos, and other guidance material to help you work safely.
Well, we just looked at several different types. Now we're going to talk about
When wearing a
N95.
mask for work, the following steps can help you correctly put it on and take it off to keep yourself and others safe. First, wash your hands thoroughly and inspect your mask. If it appears damaged, do not use it. After inspecting the mask, cup it in your hand with the nose piece at your fingertips and the straps hanging below your hand. Next, lift the mask under your chin with the nose piece up. The top strap should go over and rest at the top back of your head. If you have a second strap, position the bottom strap around your neck and below your ears. Be sure not to crisscross the straps. If your mask has a metal nose clip, place your fingertips from both hands at the top of the clip. Slide your fingertips down the sides of the metal strip to mold the nose area to the shape of your nose. Now you need to check for a proper seal. Place both hands over the mask and take a quick breath in to check whether the respirator seals tightly to your face. Keep both hands completely over the respirator and exhale. If you feel leakage, there is not a proper seal. If air leaks around your nose, you need to readjust the nose piece. If air leaks at the mask edges, readjust the straps along the sides of your head. Take these steps until you get a proper seal. If you do not have a proper seal after repeating the steps, ask for help or try a different mask. Once your mask is on with a proper seal, do not touch it. Before removing the mask, first thoroughly wash your hands, then reach up and pull the strap over the back of your head without touching the respirator. If your mask has two straps, remove the bottom strap first, followed by the top strap. Discard the mask in a waste container and again thoroughly wash your hands. Following these simple steps will help you properly put on and take off your mask and keep you and everyone else safe.
Physical distancing is going to be something that we're going to ensure the host facilities are controlling. We're going to ensure that each employee is separated from all other people in the workplace by at least 6 feet when indoors, unless it can be demonstrated that such physical distance is not feasible for a specific activity. Where maintaining 6 feet of physical distance is not feasible, host facilities will ensure employees are as far apart from other people as possible. Physical distancing will be implemented along with other provisions required by OSHA's COVID-19 ETS as part of a multi-layered infection control approach. The host facility and their COVID-19 safety coordinators will work collaboratively with non-managerial employees and their representatives to assess physical distancing in the workplace. In general, physical distance measures implemented in public areas of the station include the following as appropriate for the work location. Workplace flow, such as signs and floor markings to indicate where employees and others should be located on their direction and path of travel. Adjusted to ensure physical distancing. Physical workplace changes, such as increased distance between workstations, check-in and check-out stations. People are prevented from gathering in groups in common areas and bottlenecks, including corridors, meeting rooms, stairways, break rooms, entrances, exits, and elevators. Please also know that some of the specific workplace COVID-19 ETS plans have the amount of people that can safely occupy the room listed in their plans. Aisles, tables, counters, check-in and check-out stations, etc., have been arranged and the flow has been directed to allow for physical distancing between people. Measures to limit the number of employees present, such as telehealth, telework, flexible work hours, staggered shifts, or additional shifts are used to reduce the number of employees in the workplace at one time. The host facility will install physical barriers, such as these shown on the screen, at each fixed work location outside of direct patient care areas, where each employee is not separated from all other people by at least 6 feet of distance, and spacing cannot be increased. Unless it is demonstrated that it is not feasible to install such physical barriers will be implemented along with other provisions required by OSHA's COVID-19 ETS as part of that multi-layered infection control approach we've been talking about this entire training. Where feasible, the host facility will ensure that physical barriers are solid and made from impermeable materials. Physical barriers are easily cleanable or disposable. Physical barriers are sized and located to block face-to-face pathways between individuals based on where each person would normally stand or sit. Physical barriers are secured so that they do not fall or shift, causing injury or creating a trip or fall hazard. Physical barriers do not block workspace, airflow, or interfere with the heating, ventilation, and air conditioning, known as HVAC, systems operations. Physical barriers are transparent in cases where employees and others have to see each other for safety, and physical barriers do not interfere with effective communication between individuals. Some physical barriers will be installed when physical distancing cannot be consistently maintained and spacing cannot be increased. For example, in public-facing fixed workstations, in security screening and checkpoints. They will be doing this through freestanding on the floor and secured barriers. Some could be mounted securely to hard surfaces above the floor, or hung from above and extending down the ceiling or other fixture and secured so as not to fall, flap, or move. When it comes to cleaning and disinfection, we're going to ensure that the physical barriers that they're utilizing are properly cleaned frequently. And we are also going to ensure that host facilities are cleaning and disinfection frequently for patient areas and other areas, such as patient care areas, resident rooms, and medical device and equipment. The host facility will follow standard practices for cleaning and disinfection of surfaces and equipment in accordance with CDC's COVID-19 infection prevention and control recommendations and CDC's guidelines for environmental infection control. When a person who is COVID-19 positive has been in the workplace within the last 24 hours, the host facility requires cleaning and disinfection more frequently in accordance with the cleaning and disinfection guidance of the CDC. Any areas, material, and equipment that have likely been contaminated by that person, such as rooms they were occupying, items they touched, etc., will also receive higher cleaning procedures. For the specific details for each host facility, including their schedule for cleaning and disinfection, the person responsible for conducting cleaning and disinfection, the products that are used to clean and disinfect in the workplace, and how the business will clean patient care areas, resident rooms, and medical devices and equipment, and how the business will clean and disinfect the workplace for the positive person, please review the specific site guidelines. We will ensure that all host facilities' ventilation control contains the following. It needs to implement policies and procedures for each facility's heating, ventilation, and HVAC system. They need to make sure that it's done within the manufacturer's instructions. They need to make sure that the proper amount of outside air is circulated through the system, and a number of air changes per hour are maximized to the extent appropriate. All air filters are maintained and replaced as necessary. Any existing airborne infection isolation rooms are maintained and operated in accordance with their design and construction criteria. That they're running the HVAC system for at least 2 hours before and after the building is occupied, and that they're using portable high-efficiency particulate air, known as HEPA, fans and filtration systems. Human Potential Healthcare has instructed our employees to let us know if they have been around anyone who has tested positive and or if they're having symptoms of COVID-19 as soon as they are made aware of symptoms beginning. The host facility will screen each employee before each workday and each shift. Human Potential Healthcare will ensure the host facility's health screening and medical management control contains the following. They're going to describe how employees will be screened, whether it's going to be in person, when reporting to work, or by asking employees to self-monitor for COVID-19 symptoms before reporting to work. They may utilize the OSHA sample employee COVID-19 health screening questionnaire. If the employer chooses to require COVID-19 testing, it must be done at no cost to the employees. Please note that the OSHA's COVID-19 ETS does not require employers to conduct screening testing as of the recording of this training. The host facility and Human Potential Healthcare will notify employees if they have been exposed to a person with COVID-19 at their workplace. The notification provisions listed out in our written plan are not triggered by the presence of a patient with confirmed COVID-19 in a workplace where services are normally provided to suspected or confirmed COVID-19 patients. And this would be emergency rooms, urgent care facilities, COVID testing sites, and COVID-19 wards in hospitals. When the host facility and human potential healthcare is notified that a person has been in the workplace, including employees, clients, patients, residents, vendors, contractors, customers, delivery people, etc., and they are COVID-19 positive, we will alert you within 24 hours. We will notify each employee who is not wearing a respirator and any required PPE, and they've been in close contact with a person with COVID-19 in the workplace. The notification must state the fact that the employee was in close contact with someone with COVID-19 along with the dates the contact occurred. We have to notify other employees who were not wearing a respirator and all other required PPEs and worked in a well-defined portion of a workplace in which the person with COVID-19 was present during the potential transmission period. The notification must specify dates of the person with COVID-19 being in the workplace during the potential transmission period. We'll also notify other employers whose employees were not wearing a respirator and other required PPE that have also been in close contact with the person being diagnosed with COVID-19 or worked in that well-defined portion of the workplace, such as like a particular floor. Please note that close contact currently is defined as within less than 6 feet of distance for more than 15 minutes. In the event of medical removal from the workplace, the host facility and human potential healthcare have also implemented a policy for removing employees in certain circumstances. The host facility and us will immediately remove an employee from the workplace when the employee is COVID-19 positive, whether it's confirmed positive test for or has been diagnosed by a licensed healthcare provider with COVID-19. The employee has been told by a licensed healthcare provider that they are suspected to have COVID-19. The employee is experiencing recent loss of taste and or smell and with no other explanation, or the employee is experiencing both a fever of at least 100.4 degrees Fahrenheit and new unexplained cough associated with shortness of breath. For employees removed because they are COVID-19 positive, the host facility and human potential healthcare will keep them removed until they meet the return to work criteria outlined in the written plans. The host facility and human potential healthcare will only allow employees who have been removed from the workplace to return to work in accordance with the guidance from a licensed healthcare provider or in accordance with the CDC's isolation guidance and return to work healthcare guidance. In the event medical removal does need to occur, we do have protection benefits. This section is going to apply to employers with more than 10 employees on the date that the ETS became effective. So at this current time, that does affect human potential healthcare. We will continue to pay employees who have been removed from the workplace under the medical removal provisions of OSHA's COVID-19 ETS. When an employee has been removed from the workplace and is not working remotely or in isolation, see the written plan for details. For vaccinations, the host facility and human potential healthcare encourages employees to receive the COVID-19 vaccination as part of a multi-layered infection control approach. The host facility and human potential healthcare will support COVID-19 vaccinations for each employee by providing reasonable time and paid leave to each employee for vaccination and any side effects experienced following that vaccination. Reasonable time is considered the vaccination appointment time and any side effects experienced following the vaccination. For any questions, you are always welcome to reach out to our COVID-19 manager, and that is Kristen Van Meter. She is the president of Human Potential Healthcare Staffing. Her contact information is on this right-hand side of your slide. We have her at 3980 Tampa Road, Suite 200 in Oldsmar. You can reach her at 352-433-4474 or by K Van Meter at humanpotentialhc.com. We want to thank you for joining us today while we covered the COVID-19 Emergency Temporary Standard Plan. Again, this is a general training, so we do need you to look specifically at the written plan as well as the additional site-specific plans for each of the locations that are going to be your host facilities. Please feel free to reach out with any questions to Kristen directly or your supervisor. Thank you and have a great day.